All right. Over the past few years, many of us have noticed that the weather no longer feels quite the same. There seems hotter, heat lasts longer, and what was considered unusual has gradually become part of our daily life. Extreme temperatures are no longer just environmental issue. They are increasingly becoming public health concern, from heat exhaustion and dehydration to worsening chronic diseases and impact on mental well-being. Rising temperature affect our health, our workplace, our cities, and our communities. As climate change continues to shape our future, understanding this health impact and exploring practical solutions has never been more important. Today's webinar brings us together speakers who will share not only the science behind extreme heat and health, but also approaches to creating healthier and more comfortable environment for our communities. Assalamualaikum and a very good morning. A warm welcome to all participants from Malaysia, the SEAMEO network and our colleagues from across the region to another session of our IMR-SEAMEO webinar series. The themes for today's webinar is Heat, Health and Human Comfort, Strategies for Self-Sustainable Urban Spaces. My name is Raheel Nazakat from the Environmental Health Research Center, and it is my pleasure to serve as your moderator for today's session. Whether you are joining us as a researcher, healthcare professional, policymaker, student, or simply someone with an interest in climate and health, we are delighted to have you with us. To kick off today's webinar, I would like to invite everyone to watch a short video introducing our center, the Environmental Health Research Center. This video provides an overview of our center and showcases our research area, key project, and collaboration in advancing environmental health research to support public health.
National Institutes of Health, Ministry of Health Malaysia. We represent a collaborative network of research institutes dedicated to advancing health knowledge. The Institute for Medical Research focuses on a cyclical process of research, diagnostic, consultation, and training. This work is conducted through various centers, including those for infectious disease, environmental health, and cancer research. The Environmental Health Research Center conducts pioneering research on environmental hazards and human health risks. We also provide leadership in consultation, research, development, and training across environmental and occupational health fields. Our team consists of 22 professionals and 19 support staff. EHRC aims to safeguard public health against environmental degradation, including climate change. We play a vital role in identifying, assessing, and managing health risks through rigorous analysis and evidence-based interventions. Our work is organized into 3 units: health risk assessment, occupational health research, and climate change.
Right, we hope the video has given you a glimpse of the diverse research activity conducted at our center and sparked interest in future collaboration. Now, before we move on to today's presentation, allow me to share a few housekeeping announcements to help ensure a smooth and enjoyable session. Throughout the presentation, we encourage you to stay engaged. If any questions come to mind, please feel free to submit them using the link provided in the YouTube chat. To allow our speaker to complete their presentation without any interruption, we will be taking all the questions during the dedicated Q&A session after both presentations. For participants who wish to receive an e-certificate of attendance, kindly complete the attendance form using the link available in the YouTube chat before leaving today's webinar. And finally, if you enjoyed today's session and would like to stay updated on future webinars and research activity, we warmly invite you to subscribe to the NIH Malaysia YouTube channel and turn on the notifications so you won't miss any of our upcoming programs. With that, let's begin today's exciting session. To start off, it is my great pleasure to introduce our first speaker, Dr. Mohammad Nizam Hassan. Dr. Nick is the head of the Climate Change Unit at the Environmental Health Research Centre, Institute for Medical Research, Ministry of Health, Malaysia. He is a public health researcher specializing in climate change and environmental health and holds a medical degree from the Universiti Kebangsaan Malaysia, a Master of Public Health degree from the National University of Singapore, and a PhD from the University of East Anglia, UK. In his current role, he and his colleagues contribute to policy-relevant research that support the Ministry of Health in developing strategies to protect public health from emerging environmental and climate-related challenges. He is also actively involved in national research collaboration, technical consultation, and advocacy effort related to climate change and health. He is currently leading a collaborative project with Think City Sendirian Berhad to assess the impact of extreme temperature on mortality and hospital admission in Penang, Malaysia. Today, Dr. Nick will share his expertise through a presentation entitled Extreme Temperature and Health, Ensuring a Safer Future for Communities. Ladies and gentlemen, please join me in welcoming Dr. Mohammad Nizam Hassan. Dr. Nick, the screen is yours.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera and good morning everyone. Thank you Mr. Raheel for the kind introduction. I would also like to thank the organizer, SEAMEO TROPMED, for giving us from the climate change team the opportunity to share some of our research. And of course, warm welcome to all audiences tuning in, wherever you are. Hopefully we can have an exchange of ideas or even open an opportunity for further future collaborations. Regardless of how good or bad our presentation skills are, remember what's important is the message, not the messenger. So the topic of my presentation today is extreme temperature and health, ensuring a safer future for communities. And this presentation is linked to a research project that we are involved in. But however, before we zoom into that research project, I would like to give a bit of an overview. Okay, first of all, I would like to share some observed and projected climate in Malaysia based on 9. It has been shown that there has been an increase of temperature of about 0.24 degrees Celsius per decade. But however, it is expected that in the future, this rate of increase will be accelerated. And by 2100, it is expected that the temperature will have increased by 1.7 to 2.1 degrees Celsius, which is a faster acceleration in the future. Now, this same observation is also similar to what is seen globally, which is why WHO has already given a warning that we are going to face consequences faster because the warming is accelerating. And at the same time, I would like to share that for Malaysia, we have already experienced several episodes of heat waves throughout the years. There were heat waves events during 1998, 2016, and 2024, and even recently, in early 2026, as well as some projections that it is in the near future there will be a super El Nino happening. Now, even though the heat waves or hot weather event is felt almost entire nation, there are certain states in Malaysia which are more affected, namely those in the northern states of Kedah, Perlis, and Penang. And when these heat wave events occur, it causes an increase in heat-related illness and even cases of death. Then we know that when we project the future, the situation is actually going to get worse, because it is projected that heat waves will become more frequent, and at the same time it will be more severe with higher peak temperature. And it will also expected to have longer durations on heat wave, which means that people at risk will be exposed for a longer period, making them more at risk of developing illnesses or even deaths. Okay. So next. Okay. Now, how does heat affect human health? Allow me to share a little bit about this. I think they can be grouped into two types of effect: the direct effect and the indirect effect. In terms of direct effect, heat causes heat-related illnesses, which includes heat rash and heat cramps, which is like the mild stage of heat effect. And then there's heat exhaustions due to dehydration. But then at the extreme level or at the severe level, it can lead to heat strokes, which is characterized by loss of consciousness, confusion, and eventually can lead to death. But at the same time, there is also the indirect impact. Now, the indirect impact is more silent and less people are aware of it. But heat can also cause a strain on other systems in the body. And this can cause people with underlying illnesses such as respiratory illnesses, cardiovascular illnesses, or renal or central nervous system problems, could lead to triggering the symptoms or exacerbating the symptoms. And this could also lead to hospitalizations and even death, what we call premature death, due to exposure to hot weather. Okay, now that we talk about the impact, it's important to also understand that as all bad things in life, it doesn't affect everyone equally. Some people, unfortunately, are more affected than others. This is the same case with heat effect on human health. So there are groups of people or population that are more vulnerable or more susceptible to the impact of heat. This include pregnant women, children, elderly, outdoor workers, people with chronic conditions, and those who are living in poverty and displacement. Why is this so? For example, in pregnant women, they have a higher physiological needs, so they are more sensitive to impacts of dehydration, for example, which could affect their health and also the health of their newborn babies. And when we talk about children, children have their thermoregulation is still immature, which means they are less capable of regulating the heat in their body. At the same time, children also have a larger what we call surface to body ratio, which means that there are more exposure compared to the tiny body that they have. Another aspect of vulnerability that affects children is because the thing is, children do not control their lives on their own. They are not capable of making their own decisions. They depend on people around them, on adults around them, on their parents, for example. So let me give an example that most of us are aware of. I mean, a lot of us have heard of cases where children are left inside cars during hot weather, and some of them even died because of the exposure. So this is one example of where children, by no fault of their own, became a victim of the actions of adults. So this is why it's important to focus on children and why they are more vulnerable than others. And then when we talk about elderly, when children have immature thermoregulation, elderly, unfortunately, have reduced thermoregulation. So the ability to control temperature have reduced because of their old age. At the same time, the elderly are the group of people who are most likely to have underlying illnesses. they are most likely to suffer from diseases like respiratory or cardiovascular diseases, which is why this also causes them to be more susceptible to heat. And then when we talk about outdoor workers, their life depends on them being outdoor. So by hook or by crook, they will be exposed to the elements. So that is why they are more susceptible. And most of the jobs which are outdoors requires heavy lifting, for example, high exertion. So this contributes to their vulnerability. And then, as I mentioned, people with chronic condition, underlying diseases, will be affected also by heat. And then we come to those who are with low socioeconomic income, living in poverty. Again, they are at the mercy of the elements. Their housing, their house, for example, might not have air conditioning. They don't even have proper ventilation. And again, to survive, to support their livelihood, they also need to go out and work to find income. Otherwise, they might not survive, which means they are very exposed and they are not in control of the situation. And then displacement, we all are aware of what is going on around us right now. War, conflict, people who don't even have house, living in tents. Of course, they are more affected than others. Luckily, we might not have this situation in Malaysia, but we do, of course, when we talk about poverty, there are certainly people living in certain situations which are more exposed and less access to resources compared to others. All right. Now that I have laid down the foundation of heat impact on health, let us go into the research that I'm going to talk about today. So in 2023, Think Cities Sdn Bhd approached IMR to collaborate on a research to study the impact of heat on health in Penang. So they are interested to understand how heat affect the mortality and the hospital admission in Penang. So they invited us to join and embark on this study. So for this study, we collected mortality data and hospital admission data from Department of Statistics and from Ministry of Health. And we also collected data of meteorological data, environmental data from Met Malaysia and from Department of Environment. We also, in order to look forward in the future, because I forgot to mention, not only does Think City want to look at the current situation, they are also interested to protect the community in the future. So we need to have data. We requested data of forecasted climate in Malaysia from the National Water Research Institute of Malaysia, which is NAHRIM. Okay, so let me share some of the main findings of this study. What strikes us the most is that there are two different effects of heat on health that we found in this in Penang based on the data that we have. First, we found that there is the immediate impact of mortality, so that immediately after an exposure to extreme weather or hot weather, it leads to increase in cases of mortality among the people. And then there's the second impact, which is a delayed impact of hospitalizations. A few days after exposure, we notice an increase in hospitalizations among the community. So these are the two different timelines. Let me explain a bit further in the next slide. Okay, so in this slide, we can see that there is the immediate spike of mortality at what we call day zero, or the same day of exposure, to a few days after exposure. And then after from 14 days, the day 14 to day 28, after the heat wave or hot weather event, there will be a rise in hospitalization. So this is like a double burden to not just the community, but also to the healthcare system or healthcare provider. All right. And we talk about vulnerable population. So in this study, we also try to look at which group in Penang are more vulnerable when it comes to when an event, a hot weather event occur. So from our data, in general, we found that when it comes to acute mortality, those who are affected are the elderly and children. while when we talk about delayed hospitalization, we found that the groups that are most affected are the working age adults and females. So perhaps we need to study more these groups to identify what are the specific characteristics that causes them to be more vulnerable. All right. Now, I mentioned that we wanted to look in the future because we cannot just do damage control. That would not be enough. So we need to be prepared. We need to try and see what is going to happen in the future. So to do that, like I said, we required data from Nahrim, which is a close partner to IMR, and of projected climate temperature of Penang. So they have projected the temperature up to 2100, and from this we can see there are 4 different levels of increase. This level pertains to the different scenarios that are projected, because in climate change we project the future based on models, and these models are based on different scenarios. So the RCP 8.5 refers to the scenario where with the highest emission, where there is the lowest mitigation action, while RCP 2.6 is a scenario of lowest emission, where we do as much as possible to in terms of mitigation. And we can see here there is a clear difference in terms of the amount of increase in temperature by 2100. For RCP 8.5, the increase to around 2.5 degrees Celsius mean temperature. With RCP 2.6, the increase is around 0.6 degrees Celsius. So yes, mitigation is very important. So based on that projection, we compared it to the relationship between heat and health in Penang. And what we found, of course, it's quite logically thinking, we expected this kind of findings, but this is the evidence that we managed to find, that when looking at the different scenarios that are based on the projected climate, the scenario, the RCP 8.5, of course, will lead to a much higher impact on mortality in the future. So for RCP 8.5, we can see that by 2100, we project or we predict that deaths, there will be around near 3,000 deaths per 100 population that is attributable to the extreme temperature. Compared to, for example, RCP 2.6, the projection is around 1,500 cases. Okay. All right. Now that we have presented these findings, let's talk a bit about what we can do to reduce the impact on the community. Here I've shared 2 adaptation measures. One is individual actions, which we can educate the people to manage this situation when this acute weather event happens. So this includes ensuring that they stay hydrated, wearing light clothing, and of course limiting outdoor activity. And then there's the workplace adaptation, which is very important because people need to work. People go to workplaces, so employers need to understand that they need to implement certain adaptation measures to improve or reduce the impact for workers. This include ventilation, cool down breaks, like the World Cup that we just watched a few days or a few weeks ago. I hope you know who won the World Cup. So they even implemented the cool down breaks during the game. Of course, it's a bit controversial, but it should not be controversial when it comes to workplace adaptation. And there's a need for acclimatization for people who work in exposed to high temperature. And of course, we need to implement certain things, measures like monitoring for those who are at risk. Next, Next we have a more community-based approach, which is urban cooling. This is related to what Think City is working on. They are have more expertise in this. I'm just giving them the data on health. So urban cooling include expanding trees, having green walls, and proper landscaping to provide shading. So the best adaptation measure are nature-based because, for one thing, they also contribute to mitigation. It doesn't contribute to use of energy. So it's a win-win situation when we adapt nature-based solutions. And then there's the building strategies. In the future, building should always consider the future impact of temperature. It should inculcate things like passive cooling design, thermal insulation, and reflective roofs. I know that there are research projects going on in Malaysia right now, looking at the strategy of reflective roofs in certain communities to see how effective they are and how cost effective in the long term. So these are some of the approaches that can be implemented. And okay, so the next would be, okay, these two are related in terms of the management of the impact of extreme heat. So first, we talk about early warning. There is a need to have to improve our early warning system to allow us to have a heat health alert, which is directly linked to the meteorological information, to the level of temperature. So I know that we already have, for example, a guideline, a warning, but if it's possible, we can link it directly to health. But of course, we need all these studies and evidence to show the actual link, the quantitative link between heat and health. This would help to persuade or motivate people to take action. And of course, this will involve multi-agency, and if possible, the early warning system should be able to target vulnerable population, those who are most at risk. And then, finally, I would like to talk about healthcare readiness, because at the end of the day, when a heat wave event happens, people's health will be affected, and they will go to the healthcare facilities. So if healthcare services itself is affected by either hot weather or by climate change, we will not be able to provide the optimum health service to the people. So we need to ensure that healthcare facilities and even healthcare workers are resilient to the impact of climate change, including the impact of hot weather. Healthcare workers need to be properly trained, proper resource need to be allocated. That is one of the objectives of this study, to ensure that because we are able to have some projection of the burden in the future, so we can ensure that the healthcare system is prepared to face this future burden. So I think that is all that my presentation. I hope you have gained some knowledge from my presentation. And at the end, I am happy to say back to you, Mr. Moderator.
All right. Thank you very much, Dr. Nick, for that insightful and thought-provoking presentation. I'm sure there will be a lot of questions after this, but make sure you keep it until the end of the second presenter. I'm sure many of us have gained a deeper appreciation of how rising temperature affect not only our environment, but also our health and daily life. All right, so our next presentation will take us one step further from understanding the health impact of extreme temperature to exploring how our built environment can be designed to improve comfort, support rehabilitation, and enhance well-being in a warming climate. It is now my pleasure to introduce our second speaker, Dr. Noraishah Mohammad Sham. Okay, Dr. Noraishah is a research officer at the Climate Change Unit, Environmental Health Research Center, IMR. She obtained her PhD from the University Putra Malaysia, and her research focuses on climate change and health, environmental science, spatial analysis, and statistical modeling. With extensive experience in applying these tools to address public health challenges. Throughout her career, she has led and collaborated on numerous research projects involving heat wave, thermal comfort, air pollution, climate-related vulnerability, and healthcare resilience. Her work continues to support an evidence-based strategy that strengthens climate adaptation and protect our public health. Today, she will be presenting Perception to Stimulation, Integrated Thermal Comfort Assessment for Rehabilitation Parks. Ladies and gentlemen, please join me in welcoming Dr. Noraishah Mohammad Sham. Dr. Noraishah, the screen is yours.
Thank you, Mr. Raheel, for the kind introduction. Assalamualaikum and a very good morning to all the viewers and also people out there. I am Noraishah. I am from Climate Change Unit. My presentation today is entitled From Perception to Simulation, Integrated Thermal Comfort Assessment for Rehabilitation Parks. Okay, today I will in the next few minutes I will walk the viewers to this topic and how we could do and what we did for our projects, what's the findings, and I hope that I can share what we can do to solve this problem. Okay. First of all, we know that outdoors have healing powers. Outdoor spaces, especially in hospital, actually have essential tools for recovery. The outdoor spaces is not just for landscaping or aesthetics, but they also can provide first physical activity and mobility training. And secondly, mental relaxation and stress reduction. And lastly, we hope that outdoor spaces in hospitals give faster overall patient recovery and also rehabilitation. Okay, in Malaysia, a tropical country, climate change gives a challenge to all the peoples. Without a proper design, therapeutic areas suffers from excessive heat, solar exposure, and also poor airflow. This thermal stress disproportionately impacts vulnerable groups, especially elderly patients, leading to reduced usage and increased discomfort. In Malaysia, general guidelines leave a localized gap. We know that currently there exists Ministry of Health Malaysia guidelines. We have Malaysian standards MS 1525 2019, and also we have Green Building Index. This is valuable guidelines, but also we see that there's a few gaps that could be done to focus on the outdoor spaces. So existing standards lacks targeted guidance for first, patient thermal sensitivity during active physical rehab, the microclimate planning for outdoor therapy, and also the local adaptations specific to Malaysia's hot and humid climate. So, bridging the gap, our study is an integrated approach. We did surveys in terms of thermal comfort, and also we install a microclimate data. In a survey, we not just notice the air temperature, humidity, air movement of the respondents, but also while doing the survey, the microclimate data mobile station also pick up valuable data such as wet bulb globe temperature, predicted mean vote, and also physiologically expected temperature. This is two integrated approach. This designed to have a better space and give human feedback will merge with localized climate data and how much heat people can tolerate. Okay, for the step one, in quantifying the human perceptions, we ask users how they feel using validated tools based on international standard. ISO 7730-2005 and also an ASHRAE. We give these questions to 6 experts reviewers, which include 3 domains: the relevance, simplicity, and also clarity of the questions. So we did a validation for these questionnaires, and the scale content validity index gives more than 0.83 value, which this questionnaire can readily use for our respondents. So using this survey, we want to track first the thermal sensation, which we want to know how hot it is. And secondly, we want to know the thermal comfort, which questions is how tolerable can the heat to the respondents. And lastly, we want to know what is the thermal preferences, what would make it better for the respondents. Okay, the next steps, we measure the microclimate. We install the microclimate weather stations, and the census is recorded the exact environment at human level, which is 1.5 meters above the ground level. This is because this is the standard height for human while standing, and we didn't want to know what is the temperature out there. We want to know what is the exact temperature of the respondents while they are doing the therapy or at the exact time at the sites. So using this microclimate, we capture every single minute, and it tracks 8 hours from 8 in the morning to 4 p.m. Okay, here I would like to show how the installation process of the microclimate. Let's see how the sensors. This is all the sensors that we use. Each one of the sensors give different readings, and with this mobile microclimate, it is easy for us to bring to each sites of the study sites in the rehab area. This is our staff installing the station before we do the surveys. So we set up before 8 a.m. so that we know where to locate the sensors and install it, which area that we don't want to disturb the operating services given by the hospital. So these sensors have to be located at the correct area and not disturbing the rehab therapy. Okay. Okay, the next step is the simulation. Simulations is not just detailing on the location and vegetation of the area where we do the survey, but also using the NVMAT software. Is a microclimate software which took a few graphics where they know where is the vegetation, what is the design and landscaping, so that using this software we can offer and plan what is the most suitable design that can be used for the engineering sites to design the rehab area for optimize more relaxation, while they also give comfortable place for the respondents. Okay, this is another video which I would like to share the next few minutes while the patients and the guidance and also the staff of the hospitals did therapy while in the study sites, one of our study sites of the study of our projects. And while they are doing the rehab in the morning, we also install the microclimate mobile station near to the park over here, and we can actually have the real-time weather parameters values, and also we will give a better index to tell how they feel and what actually the vegetations and the design of the landscaping in the rehab area will help them in the future for a better solution for the patients. Okay, this exercise is actually did by the patients twice in a week. Okay, besides all the steps that we did, we also do a pilot study testing the real hospital environments. So we selected 3 therapeutic parks in the hospital based on the inclusion criteria. Firstly, the specific courtyard size and surroundings, wall heights, and also the park have a high frequency of patient use. Okay, this is the findings of the pilot study, the voice behind the data. We surveyed 30 adult respondents exposed to the outdoor park environment. 46.7% of the respondents come from hospital staff. 36.7% of them are visitors, and 16.6% are the patients. We noticed that 44.5% of the respondents visited the hospital 3 to 5 times a week. So they actually are frequent users of the park in the hospital. Okay, the comfort surprise for design mitigates heat. Despite Malaysia's baseline hot and humid climate, the microenvironments of the parks provided significant relief. 45.8% of the respondents reported that they are feeling a neutral thermal sensation, while 24% of them reported feeling very comfortable. If we see from these numbers, we can conclude that they are feeling good, they are feeling comfortable, but these numbers is not the actual how they can adapt to the heat. So this is just the preferable how they feel. So this is why we need the microclimate station to be there to tell us what is actually the index at that time. So the natural human adaptation strategies. When respondents feel warm, they rely on simple, accessible interventions to regain comfort. What they did is, firstly, they prefer to drink water. They want to take a shade a break. They are seeking out portable or ceiling fans, or they just adjusting their clothing. The physical difference makers, why were some areas more comfortable than others? So localized thermal comfort is directly driven by 4 physical factors. One of them is the overall shape of the courtyard space. So some space are very rigid, some space are very free space, and some are very crowded space. So second, strategic plant and tree configuration. This means that where you want to locate the trees and what type of species of the vegetation that you want to put in that area. It does matters. And also building height and wind layout. So the layout also give a meaningful landscape design to the rehab parks. And lastly, the nature of underlying ground surfaces. Okay, we did also a case study for simulations. First case study is we name it as case 0. The justification is just the real condition. This is the baseline of the study. And the case 1, we try to increase the number of trees. Case 2, we add water features. Case 3, add some shading or awning. And case 4, we mix the scenario, integrating the case 1 and case 2. And lastly, the case study 5 makes scenario from case 2 and case 3. So using the NVMAT simulation, we hope that we can shape the future of the tropical healthcare. First, pioneering the climate resilient care for all, fostering local innovation collaboration with our network and building sustainable healing environments. We also ensuring equitable access through adaptive design. And lastly, we want to work together for healthier future. So at this slide, I hope that we are not just doing a project, we are not telling the problem. We hope that we can offer some of the solutions that we can do for a better, healthier design, not just an aesthetic. So with that, thank you and hope to hear from all of you viewers soon. Pass to you to Mr. Moderator.
All right, thank you very much, Dr. Noraishah, for that insightful presentation. Such a remarkable and interesting findings. All right, we will now move on into one of our most interactive parts for today's webinar, which is the Q&A session. Thank you to everyone who has been submitting questions throughout today's webinar. We truly appreciate your active participation and engagement. Okay, so let me just have a look first. What are the questions that we have here? All right, so I think the first question is actually for you, Dr. Nick. It actually comes from Dia Rahmi Yuniarti. The question is actually as such: how to maintain and also keep the health in our neighborhood so that it is in a safe condition, healthy, and always provide protected, insured and secure from the disease and disaster.
Okay, thank you, Dia Rahmi Yuniarti, for the question. This is a very, very big question. How do we protect the health of the community? It's not easy, of course, because it requires the cooperation of all the parties involved. All the stakeholders must work together to ensure that everything is done properly, because we are talking about a community which are affected by many factors that surrounds it. Of course, it needs to have a proper, even from the beginning, proper planning is essential to ensure that the housing is built with the health or well-being of the people in mind. And then to ensure that, say, one of the things that we may be lacking is the ability to calculate looking at the question, the maintenance part, because we may be, sometimes we build a very nice housing area, but then it deteriorates, there are not enough maintenance happening. So in terms of planning, proper budgeting must already be included to consider the maintenance part. And of course, it needs to have proper access to healthcare, for example. But then we need to talk about how the community is aging, how when we talk about healthcare, it is not just about clinics for treatment, it's also about supportive therapies like physiotherapy and things like that. So it's a very comprehensive approach if we talk about how to protect the people's health and community. But thank you for the question. Hopefully this is the kind of future, the kind of neighborhood development that we are going to see in the future.
All right, thank you very much, Dr. Nick. Okay, we can proceed to the next question. All right, so the next question actually comes from Dr. Firdaus of IMR. All right, I think this question is for you, Dr. Noraishah. Thermal comfort is influenced not only by environmental condition, but also by an individual physical and physiological characteristic. How can integrated thermal comfort assessment model account for this complex interaction to ensure rehabilitation parks are inclusive, evidence-based, and resilient to future climate change? Dr. Noraishah?
Thank you, Ms. Raheel. Thanks to Dr. Firdaus for the questions. Actually, this study found out that there is a gap in our guidelines. So in Malaysia, so this study perhaps will fill the gap with the revisions of the Malaysian guidelines, or we can give supplements which focus on the rehab parks personally, and we hope that outdoor rehab gap will be identified from the start, not just saying at a specific area, but also to inclusive to all parks, rehab parks in hospital in Malaysia. Back to you. I hope this answered the questions.
Okay, thank you very much, Dr. Noraishah, for that answer. All right, we can proceed with the next question. Okay, the next question actually comes from Shahriman of Kelantan, and the question is actually being directed to Dr. Nick. All right, can the result or the findings from your study, okay, be used for other states in Malaysia? And if so, should this study be repeated for the other states? Dr. Nick?
Okay, thank you very much, Mr. Shahriman from Kelantan, for asking this question. It depends on a lot of factors, because first, of course, we need to understand that different states certainly have different situations. We cannot really directly compare between states, because this study was done in Penang. It has certain characteristics that is specific to Penang. So in Kelantan, for example, the situation might be different. But at the same time, findings from this study can be used as a guide, or it can give an idea as to which community need to be studied, which group, vulnerable group that can be focused on. So you can use the findings from the study as an idea or guide as to what kind of study that you are looking for. And then there's also the question of data availability, because for our study, the methodology that we used was time series analysis. And for time series analysis, comparing between heat or temperature and mortality and hospital admission, we needed a certain amount of data or cases to be available that allows us to find strength in the association between heat and the cases itself. So Penang has a large enough population to allow this to work out. But then we need to look at that state. If it doesn't have enough cases, then we need to think about the methodological approach, the type of, maybe they need to approach with a different method of study. So these are all the things that need to be considered. So by all means, I do think that each state or each region need to have some study to identify the local issue, so that in the future adaptation measures are developed or based focus on the issue that is actually happening at hand, and it should be evidence-based adaptation. So yes, by all means, I think all states should embark on this kind of study, but what type of study, what type of methodology, it depends on the situation. Thank you for the question.
All right, thank you very much, Dr. Nick. I do agree with you that we need to focus on the local issue. As such, this kind of a study need to be conducted at the local level as well. All right, now we go to the next question. This one is actually for Dr. Noraishah. It comes from Benjamin Nichols of Philippines. The question is, why use 3 different indices, WBGT, PMV, and PET, rather than just focusing on one? Dr. Noraishah?
Okay, thank you, Mr. Benjamin from Philippines. Actually, each of the index captures different aspects of thermal stress. For example, WBGT captures the heat stress and occupational safety threshold, whereas PMV used to in grounded indoors, but often used for outdoors. And lastly, for PET, actually it is specifically designed for outdoor thermal comfort. So we hope that by combining these 3 indices, it will give and provide a converging cross-validated evidence, especially for our study. I hope this answers you. Back to you, Mr. Raheel.
All right, thank you very much, Dr. Noraishah. All right, unfortunately, due to time constraint, we are unable to address all of the questions submitted. If your question was not answered today, please don't worry. Our speakers will do their very best to respond to the remaining question through email. All right, so as we conclude today's webinar, I would like to extend my sincere appreciation to our distinguished speaker, Dr. Nick and Dr. Noraishah, for sharing their valuable expertise and insightful presentation. Today's discussion have reminded us that addressing extreme temperatures goes beyond understanding the science. It is about protecting our public health, creating healthier and more comfortable environment, and building communities that are better prepared for a changing climate. I would like also to extend my sincere appreciation to all participants for joining us today. If you found our today's webinar is informative, we encourage you to share it with your colleagues and continue following us through our YouTube channel for future webinar sessions. Before we conclude, I would like to invite everyone to join us for the next session, which will be held on the 21st of August 2026. So do mark your calendars. The theme for our next webinar is From Blood to Blueprint, Malaysia Journey in Thalassemia Screening, Diagnosis and Prevention. On behalf of the Institute for Medical Research, the National Institute of Health Malaysia, and SEAMEO TropMed Network, thank you once again for being with us today. Until we meet again, take care, stay safe, and have a wonderful day. Assalamualaikum warahmatullahi wabarakatuh.